All right. So, have you started? So, what we're going to do now is look at the peripheral nervous system. So far, we dealt with the nervous system around the brain and the spinal cord. Now, the spinal cord, it's kind of, you cannot see it because it's inside the spine. The spine protects it. Here there is bit, and in front there is bit as well. So the spinal cord is running all through the spine all the way down. And do you see the yellow bits? Mm-hmm. These are the peripheral nervous system. So what is the peripheral nervous system? They are nerves emerging away from the brain and the spinal cord. Some of the peripheral nervous system, or I'll give you an example. Let's say you need to get the nerve to feel the lips. Okay? So do you think it's going to be reasonable to think that this nerve would come from here to the lips? No. It doesn't make sense, right? Because you want to be neat, yeah? So would it come from here? No. No? So what it comes is probably through the brain. You see all these holes in here? Maybe it will come through here, and we'll do that. Okay? So certain nerves of the peripheral nervous system coming directly from the brain. Let's say here, when you touch the face or the muscles of the chewing, they're all coming directly from the brain, and then there are little holes from the brain into the eyes, into the nose, yes, and all the nerves going outside from there. The rest of the peripheral nervous system coming from the spine. So, and it kind of lies in a reasonable way. For example, you want to send a nerve from the spine to the arm, let's say to the palm, okay? So where are you going to do it? You're going to do it from here, or from here?
The first one.
From the first one, yeah? So, yeah, well, why? Because nature needs to be neat and reasonable, yeah? So, for example, all the nerve would come to the arm, come from the neck. They originate from the neck, and this would be the pathway of this nerve. So that it will go under the clavicle. It's not going to go above the clavicle, because if you have a hit here, the nerve damaged, yes? So it needs to go underneath.
So how do the nerves go around a joint?
It will go around, not directly, but will be, and the joint, remember, it has a capsule.
Yeah.
So it's separate.
So it goes over the top of the capsule?
It will go outside the capsule, in here, all the way to here. Yeah? Okay. Have you heard?
Sorry, Joel.
Yes.
But that is the one question. Is sciatica not something to do with nerve tract in between joints and muscles?
Not between. Well, okay. Okay, I'll explain.
Thank you.
Okay, sure. I'll continue and then I'll come back to it, okay? Let's continue now to the nerve that supply the knee, okay? Where do you think the nerve that supply the knee will come from? Here, here, or here?
Bottom.
So, yeah, so it will go from here, even, you see that bit here? That's called a sciatic notch. It's kind of nice to lie. It's a nice notch here. Yeah? You see, it's kind of funny because you're thinking, why is it doing that bit here? Why does it have this bay? Because that's where the sciatic nerve runs. Yeah? And it runs like that. Okay?
Are they also involved in pregnancy?
Sorry?
You were saying earlier, they're also involved in pregnancy.
What is wrong?
These nerves around the hips.
All the nerves may be involved in pregnancy. What I can't remember. Can I finish and then you can ask questions? Okay. So all these nerves come to here. So certain nerve would go in front, Yes, so they will supply the areas in front. So they will come around and wrap nicely around here and go to the front of the knee. Yeah? So there is a logic to where the nerve's coming. So the peripheral nervous system really kind of organized nicely. Now, if we have a nerve here to let's say to the arm, what is this nerve what's inside there? What does it do? What kind of messages it sends? To where? To what?
To lift the arm, to flex the elbow.
Yes. So it can do, how do we call it? This kind of nerve?
Motor.
Somatic motor nerve. It's somatic, yeah, because it's deal with the body. And it's a motor nerve because it does moving. Yeah. But can also, the same big nerve can have some of the motor neuron and some of the sensory neuron?
Yes.
It can have. So if you see a big bundle of neuron, some of it would go from the brain, send action, some of it will bring sensory to the brain. So it's kind of, here you have many, it's like a motorway. Few goes that way, few lanes go that way, few lanes go the other way. Yeah? So here, you have many small neurons. Few goes that way, and few goes up toward the brain. Is it all right?
Yeah.
Yeah, understanding. Okay. So that's generally the outline of the peripheral nervous system. It has both somatic, sensory, and somatic motor. Yeah, to send signal to the brain and from the brain action. I think that's it really. Yeah, let's close now.